So welcome to this week's episode of Leadership Soundbites. Rocco had a conflict, but I have the great pleasure to be in the room with Dr. Nicole Barnett. She is, and I'm going to read this, COO, Chief Operating Officer, CNE, Chief Nurse Exec with Kaiser Permanente in Richmond, California. And Nicole and I connected on LinkedIn, which I love that. And we had a conversation and realized she needs to be a guest on the podcast because she has a really strong perspective on our topic. So this week's topic is on the power of health equity. And I'm going to kick us off with a quote, and there were several of them, as there typically are. This particular one resonated with me and Nicole as well. And I'll tell you why in a minute. So here it is from Jim Marks with Robert Wood Johnson Foundation. It says, even as we think of health equity as the outcome, we know that health and well-being are nurtured, protected, and preserved where people live, learn, work, and play. And so for me, I read so many other quotes around health equity that move me, and move me to a point where I look at it and say, if I'm not in the healthcare space, how can I do anything about this gap that we have, right? The inequity in the health space. And when I read this quote, I thought, I can see myself in this. I mean, I do coaching,
Right.
I do executive coaching. So I have the opportunity to consider to create a different space for people mentally, right? Mindset wise, so that contributes to their health. And pro bono work that I do that will contribute to people's health where they didn't normally get access to it. And so I appreciate this opportunity, Nicole, to talk about this topic and the opportunity for me to see myself in closing the gap.
Yes.
So what's on your mind?
I love that you open with that quote. It talks about how health is not necessarily created in hospitals or in clinics or in a visit to your doctor. Health is created in our lives, in our communities, where we live, work, learn, play, where we worship, all of those places, right? Because it's about health of your body, health of your mind, your spirit, your soul, your mental health. And we go to the hospital and we go to the clinics to address when things aren't going well or to figure out how to stay on track to get healthier. But health is created every day and every moment with our interactions with one another. And it's impacted by the healthiness of the communities or the lack thereof that we live in.
Mm-hmm. What came to mind for me too, you say that, is I think about compassion and caring for a fellow human being, right? No judgment.
Right.
Or, unfortunate circumstances that people may be in that maybe we don't find ourselves in, but there's no judgment there. But it's like, how can we step in and start closing gaps? And I'm going to go back to a quote from Rocco and I's mentor, Margie Haganey. What's a little bit better look like? Because a lot of times people think, well, I don't have the resources to do something about that, but could you do some little thing about that? And part of that could be compassion and kindness for that individual or for individuals.
Yeah, compassion and kindness. And in addition to that, think about biases. Where do your biases individually show up in the way that you make decisions, in the way that you impact policy in your community, in the way that you vote, in the attitudes you have towards how our resources are shared in our communities, how our tax dollars are spent, your attitudes, your biases around homelessness in our communities or mental health challenges in our communities. Because if we can just take a moment and just interrogate our own biases and say, where does that come from? Is that actually rooted in any level of truth, or does that come from somewhere else, and does it represent prejudice? And should I address that bias and change it and look at it differently, look at it from a more compassionate lens? If we could get there, we could have wide-scale policy change that could overcome the systemic inequities that we have in our system. When we start to see each other as not just partners, but neighbors in our communities, people that we care about, like we care about family, it changes a lot of things and can overcome what we call the social determinants of health in our communities in a way where all boats rise. We can improve our communities around access to schools, great schools, access to libraries, walkable, safe neighborhoods, parks where kids can play, easy access to healthcare resources when you need them, access to a decent grocery store so that you're not living in a food desert, right? All of these things are impacted first and foremost by our biases. Then our biases show up in the policies that we support, the way that we vote, the way that we direct our tax dollars, and it shows up as inequities. When it comes to health equity, it really is about us, every single one of us having the opportunity to have a fair shot at having a healthy life and the best life expectancy policy. But we know in the United States, it's largely impacted by where you live. We used to, some people, refer to zip codes, and your zip code determines your life expectancy. Now, public health experts are looking more at census tracts, because census tracts are more geographically located, where a zip code, I can have a zip code that's just an efficient way of delivering mail, and zip codes can represent different neighborhoods and different resources. But when you look at it by census tract, you get a startling understanding of the geographic impact on life expectancy and access to resources that overcome the social determinants of health. So it's when you start to think about it through another quote you and I shared just before this from Nelson Mandela, which says, health cannot be a question of income, it's a fundamental human right. And that's the way we have to look at it. Like you said, from a lens of compassion and caring. If we know that if we feel and believe it's a human right, then we'll move forward in that way for all people. But what we find is that I don't think enough of us think that way yet. I don't think enough of us believe that it's a human right to the extent that we are impacting policy and changing the way that communities are resourced.
What comes to mind for me, Nicole, when you're saying that, right? Because obviously, and I know you got your doctorate in
health sciences.
Thank you. You're very well versed in this. And as you're talking, I'm thinking about, do listeners understand the levers that they can pull? Or do they think that when they hear health, equity, right, they may have a definition of what it is, but think, I can't possibly do anything about that because I'm not in that role. And when you're talking about all these things to where you're going, you can do this, and I'm thinking, here are all the connections about what we can do, and yet how many of us actually realize it?
Right. We don't, because the word health is in that, we think that's the domain of the healthcare system, right?
Yes.
But it's like we said before, health is something we aspire to every single day of our lives, wherever we are. We're not living our lives inside the healthcare system, and anyone can impact that. Healthiness is about community. Healthiness is about healthy societies, healthy relationships. All of us can impact that in so many ways. And I think if we take it back to understanding that we're promised as citizens of this country access to life, liberty, and the pursuit of happiness. How can you be happy if you cannot be healthy?
Yeah.
We look at it as a human right, as a constitutional right. It kind of changes our thoughts and our behaviors around it, and it makes us look at our communities differently, recognize the inequities, and then ask, how can I impact that? You can impact that by writing a letter to the city about something that you notice is a gap in the city in terms of health equity. An example is one that I heard from an elderly patient who said that she's independent, she lives alone, she takes advantage of certain public access and paratransit, resources. And she told me how they're so disconnected that she's got to get to certain places at a certain time to get from this transportation resource to the next transportation resource, and has to line up her visit so she's back on that line by this time, or else she's coming out of pocket for an Uber ride, which on a fixed income. So those things, when you hear the stories and you put yourself in someone else's shoes, then you can begin to build that compassionate muscle to say, I can do something, even if it's as simple as, who do I write in the city? Who do I write to the mayor? Do I reach out to my congressperson or my senator for larger scale issues? Just get active.
That's interesting. And this is going to be bad, I'm going to admit it. I've never done that. I've never written a letter to go do that because my brain doesn't go that that's the path to fix X. It just doesn't. What came to mind for me when we were talking is several years ago, I was in the Bay Area for, it was around lean process improvement event in healthcare. And there was a healthcare leader that was from back in Virginia, and he's within Medicare too, that he does stuff. But anyway, and I'm sorry, I don't know the name, but this is the situation that came to mind for me. He was talking about, because he was in the CEO role for his hospital, that they were talking about the indigent population, people are underserved, all that stuff. And what he realized is, and he asked the question, how many of our own employees are in that situation. How many of our own employees that are on our payroll are living out of their car? They can't afford, whatever it may be. And he was shocked to discover the number of employees that were on their payroll in the hospital that they weren't taking care of. And so I think when you think about it, when you were talking about all that stuff, and I'm thinking, if you're a leader in an organization, whatever part of the organization, take the blinders off.
Right.
Start from a place of curiosity and understand and ask yourself before you start going, are we okay here in our own house?
Yes.
Our own family? Or is there opportunity right here at our doorstep?
Right. So true. I've had a similar experience where a staff member revealed to me her situation. She wasn't in the situation currently. She was telling me about it from years before, and how getting that initial opportunity with our company was a huge turning point for her. But for several months, she was living out of her car.
Exactly.
Just doing her best to get to work and do a great job and get on her feet. And then another example is we had set up some resources for closing social determinants of health gaps for our patients. So sort of a little resource desk, like if the doctor finds out that you're food insecure, well, we can get you a voucher to the food bank, those types of things. And we were surprised initially to realize how many staff were realizing that there was a resource desk there and were taking advantage of resources because they were in need as well.
Exactly.
Because we're, those blinders, like you said, you have those blinders and you think, well, you have the safety of a great job and you think that's good enough. But sometimes a great job is only the first step. And there's additional steps that need to be taken to really get into a position where you and your family are more secure.
Yeah. And to your point, and those employees don't show up at work, with a sandwich board going, hey, they're not going to brag about it, but it's one of those things. Look here within what's right in front of you, so that you can start figuring out what you can do there if you're not looking to, on a broader scale. Yeah,
exactly.
I just, the opportunities, I think they're huge. And I appreciate this time. There was another quote. Now, the Nelson Mandela one, I'm going to read this other one because it's interesting too. And I'm putting the challenge out to all of us to start viewing this differently. It's Shania and Taylor, and I hope I'm saying this right. Health equity supersedes the consideration of you and me. It's the ability to tackle disparities widely and innovatively. Yes. And I love that part on the innovatively part because there's think outside the box. Right. This doesn't have to be some pre-described path that someone else went down already. Right. Look, find a gap. Yeah. And get really creative on how you can close the gap. And I'm going to pull one more thing in that John Maxwell said, and it drives me to a lot of things because Rocco and I had this conversation before. He said, do for one what you wish you could do for many. And he may have said it, or the guy from Chick-fil-A, but what drives me on is if you may want to help, okay, 1,000 people, 10,000 people, 1,000,000 people. But if you're only in the position to help one, do it. Right. Do for one what you wish you could do for many. And I think that's the encouragement that I have around this whole idea of closing the gap of health equity for everyone, and start with the people around you. You don't have to go far. Right. You don't have to go far. Yeah.
I love the quote about addressing health disparities through innovation. I think we've grown. I would like to say we've grown in the healthcare community of understanding that health disparities exist more because of lived experience and certain and life circumstances rather than by genetics. I mean, decades ago, we probably would have said, oh, you've got a predisposition for some reason. I have a predisposition for generational poverty, maybe, but less than for the
rest of
the health outcomes, right? Exactly. So I think we've grown a bit in that way. I think we're still trying to grow in terms of how we address the disparities. And for so long, we've expected people to find their way to our door and walk through it to receive, an assessment and care and whatever, we have to realize that it's our responsibility to go outside that door into the communities in whatever ways we can. And an innovative way, it might not seem so innovative, but it is innovative, is to build those community partnerships. Where do those individuals live? Where do they work and play? Where do they socialize? Where do they worship? And can we partner in that community to be able to come in and educate around disparities, educate about how to reduce the impact of chronic conditions and partner directly at the community level. Because the partnerships are out there to be made. You know, that's it's a welcome and open hand on the other end. I think the healthcare system needs to feel more comfortable reaching back out and initiating those partnerships.
Yeah, you're absolutely right. The thing that came to mind for me is we don't have to know how to fix it. There are people already set up working in that space, right? So it could even be, if you're an individual, donating time.
Yes.
You know, if you've got like I'm a coach, and so donate time to people that can't, you know, to help shifting mindset, and so people can actually see something's possible, something beyond what we're currently in.
Absolutely.
So I think there's a lot of different opportunities that we can do with what we have, you know, our resources, our skill set, our, you know, view on life, and it can be one person at a time.
It can be. And those partners in the community are so important because they are trusted messengers.
Yeah.
When we partner with them, it gives us more credibility.
Yeah.
Right?
Yeah.
Because the community knows them, they're embedded in the community, they trust them, whether it's a pastor, whether it's a teacher, whether it's a community organizer. Yeah. And when we come alongside, you know, from a place of humility and partner, then we take advantage of the opportunity to be with a trusted messenger who can carry, you know, health messages forward that people will resonate with. You know?
Well, and I think the other part of it is, because my brain went, is it doesn't have to just be people that are in the healthcare space.
Right.
I think this is the encouragement and call to action, regardless of what industry you're in. Yeah. Because this is your community that you live in and work in. So yeah, I'm excited because it's opened my brain to possibilities that I hadn't thought about before until I'm like, we can do this.
Absolutely, we can. Everybody's got a skill or a talent that they can offer. And every bit of that enriches a community or enriches an individual life.
Yes.
And every time, anytime you can lift someone up in any way, it's going to impact their overall health. Absolutely.
Yeah. So thank you. Thank you for this time. Thank you for the topic. And just your grace in talking about it, your enthusiasm and knowledge. It's just awesome. So what are 1 to 2 things that you want people to walk away with around the topic of the power of health equity?
I think the first thing is to educate yourself on what health equity is, how health equity can be achieved, and what are the barriers to achieving health equity for individuals and for communities, and just open yourself up to looking at that through a different lens.
Yeah.
And then the other thing is to know that the inequities in our society are not accidental. They've happened through just a systemic process of marginalizing underserved communities, impoverished people, through processes like redlining. And then really think about, rather than blaming people for the circumstances they're in, really think about what brought them to those circumstances, what keeps them trapped in those circumstances, because that legacy of redlining and institutional inequities and racism continues. So then how can you as an individual impact that in a more positive way? So I would think those are the most impactful things that I would say. Educate yourself and then really understand that this didn't happen by accident.
Yeah.
It will take intention to fix it, lots of intention and collective political will to fix it.
Yeah. Thank you. The thing that comes to mind for me and all that, because if it can sound overwhelming and daunting, right, of all that stuff, is go from the back to the mindset. What's a little bit better look like? And even if it is individual touch points that you have with people that are from or in an underserved area, community, homeless, go with grace and compassion, not judgment. And I think part of it, I think that's huge. That will go a long way, because I think a lot of times what happens is people tend to be uncomfortable with people that aren't in a similar situation that they're in. And so that they deal with that uncomfort as ignoring. And I think validation or acknowledgement is powerful, because we're humans and we do exist. Right.
We all have a propensity towards social sameness. We're comfortable in social sameness, whatever that is for us. Yeah. But when you're feeling a little uncomfortable, that's a sign you're in the right place. Lean into that discomfort, learn and grow, make an impact.
Yeah. Face your fears and do it anyway.
That's right.
Thank you very much. And I look forward to another conversation we'll have down the road at some point, hopefully.
Absolutely.
Thank you again. This has been Leadership Soundbites, the power of health and equity, with Michelle this time and Dr. Nicole Barnett. And thank you very much.
Thank you.